So coming to our next question number 23 in previous year NEET PG. It's a 2024 question. So this seems a very big question with an image. So reading from the last line, which of the following will be the appropriate next step to order? So we have to find out the diagnosis and we have to tell what is the next appropriate test. A person is brought to the hospital for evaluation of drooping of eyelids and muscle weakness and fatigue more towards evening. She also had dysphagia. Evaluation showed normal blood parameters. CT check showed the following finding. So in 2024, many NEET questions were like integrated questions. Like it was not a straightforward image question. So questions were mixed from medicine and radiology, medicine and ophthalmology findings like that. So that's why this is such a big question. So I will decode the question. Patient has drooping of eyelid, which is ptosis. Patient had muscle weakness and fatigue. The clue here is it is more towards evening. So I think most of us would have come to a diagnosis. This is a clear case of myasthenia. So myasthenia actually presents with muscle weakness. Muscle weakness all over the body. So they may have limb weakness. They may have ptosis, drooping of eyelid, so it is eyelid weakness. They may have dysphagia. So it could be any weakness. Sometimes patients will not be able to tell the diagnosis of weakness and they just report fatigue. So the clue can also be fatigue. But the word is fluctuating fatigable weakness. So clearly this is Myasthenia gravis. Why there is actually a fluctuating weakness? Because as time goes on, as more activity is done, you know very well that Myasthenia gravis is a problem with anticholinesterase or acetylcholinesterase antibody. Maybe we can explain with a simple neuromuscular junction. So this is the nerve ending and assume that this is the muscle. So this is the neuromuscular junction. So normally muscle endings will release acetylcholine. I think we can enlarge the image. Nerve endings will release acetylcholine receptors, acetylcholine. Those acetylcholine will bind to acetylcholine receptors in the muscle end plate. That leads to action potential and muscle contraction. This is how things occur. So in myasthenia gravis, what happens is there are antibodies which are produced against these acetylcholine receptors. So acetylcholine receptors in short are labeled as AChR. So we have anti-acetylcholine receptor antibodies in myasthenia gravis. So what happens when antibody attacks these? The number of receptors reduce. So the binding of acetylcholine to the acetylcholine receptors in the muscle end plate reduces. So action potential reduces, muscle contraction reduces. As time goes on, the fatigue will increase or weakness will increase because some amount of all the receptors get utilized as action goes on. Okay, assume there are 100 receptors initially and 100 functioning receptors initially and there is 50 acetylcholine released. But as time goes on, more number of acetylcholine vesicles get released. So all the receptors get utilized. Already the number of receptors are low in myasthenia gravis. So that is why. Because of the number of acetylcholine receptors get utilized by acetylcholine with prolonged activity, there will be worsening weakness. So this is called as decremental response. That is when we are doing electrophysiological study, when we are continuously giving electrical stimulation in myasthenia gravis, the action potential decreases. That is called as decremental response. There is one disease which is opposite of this, that is causing an incremental response. This disease also causes muscle weakness. So decremental response is reduced action potential with continued muscle activity. It is due to increased acetylcholine receptor engagement occurs in myasthenia gravis. Incremental responses, increased action potential with further muscle stimulation. This occurs in a disease called Lambert-Eaton myasthenic syndrome. So like these two will be the differential diagnosis. Myasthenia gravis is a primary disease usually associated with thymoma. Lambert-Eaton myasthenia syndrome is a paraneoplastic syndrome associated with small cell carcinoma of lung. This myasthenia gravis is a problem with the post-synaptic acetylcholine receptors, right? Whereas this Lambert-Eaton myasthenia syndrome is a problem with the presynaptic calcium channel. You know very well that there are some calcium channels in the nerve ending. When calcium enters, they help in release of acetylcholine vesicles into the neuromuscular junction. So this Lambert-Eaton myasthenic syndrome is a problem with presynaptic calcium channels. Remember, these presynaptic calcium channels are also the ones which are affected in crate bite, whereas the postsynaptic is affected in cobra bite. Okay. So here the receptor is anti-acetylcholine receptor antibody. Here it is voltage gated calcium channels, VGCC channels, presynaptic VGCC channels, or the antibodies, anti-VGCC. Okay. So, and decremental response, incremental response. How will you treat myasthenia gravis? We have to increase cholinesterase. So acetylcholine receptors are getting broken. So we have to increase as much acetylcholine as possible. So we have to give cholinesterase inhibitors. Cholinesterases are enzymes which break down acetylcholine. So when we inhibit cholinesterase, acetylcholine levels increase, so they can bind with more receptors, right? So cholinesterase inhibitor, example is pyridostigmine. If you remember, OPC poisoning is also cholinesterase inhibition, right? We have neostigmine. Plus we can use steroids here. Now what about Lambert-Eaton myasthenic syndrome? It's a paraneoplastic syndrome. So we have to remove the antibodies. The treatment here is plasmapheresis. Okay, so just a small revision about Lambert-Eaton myasthenia syndrome versus myasthenia gravis. So this question is clear. They are given a decremental response. So more towards evening, fatigue and muscle weakness increases. There is ptosis and dysphagia. So this is clearly myasthenia gravis. And see the clue, this is thymoma, right? Anterior mediastinum, there is a mass. So this is a thymoma. So this is clearly myasthenia gravis. The question is simple. Which has the next step to order? Anti-acetylcholine receptor antibody, anti-MuSK. Seems right. Creatine kinase levels are increased in muscle disorders. This is a neuromuscular junction disorder. So this is not the answer. Calcium levels have nothing to do here. Vitamin D levels also have nothing to do here. So the answer is more or less straightforward. But since the question is long, we should be careful in identifying it.